Hi, welcome back to Sisterhood and Surgery. Today's topic is mentoring millennials in the digital age. I'm Linda Lay, your host. My co-host is Palma Shaw. Before we introduce our guest speakers, we encourage the audience to participate in our conversation. So you can do so by texting DEBAKEY at 37607 with questions, or go to pollev.com and enter DEBAKEY. And again, my co-host Palma Shaw. I'm going to introduce one of our guest speakers, Malachi Sheahan, who was my original mentor, who let me do my first fistula ever, my first amputation ever, and my saphenous vein harvest as a third year. And it's why I'm a vascular surgeon today. He's a badass. Palma?
And I'd like to introduce Ellen Hagopian. She's a core associate professor of general surgery, a very highly trained Hepato-Pancreato-Biliary Surgeon, and also the surgery clerkship director at Hackensack Meridian School of Medicine. And Ellen and I go way back to medical school, where we were both actually competing to go into otolaryngology. Thankfully, we both saw the light, and now she's hepatobiliary and I'm vascular. So I've asked her to come and share her experience today.
Thank y'all for being here. So we'll go ahead and start. This show is about, mentoring in the millennial age, and especially the digital age, especially with COVID now. So how has your mentorship style changed over the years, and what advice can you give mentors on how to improve their mentorship skills?
Well, I think that, I've been running the vascular training program here at LSU since 2005. And when I came in, I thought, I'd be much more like my attendings, kind of very dogmatic. This is how I do things. But then I saw that the senior surgeons kind of had the same thing. So I decided I was going to be much more kind of like the mentor that I wanted, letting them try and succeed. Apparently, I let you do a bunch of cases in medical students, so maybe I don't have the best judgment. But I'm more kind of take an interest in what the students and residents want to do. I think too often mentors try to mold people to look like them and do what they want to do and be interested in things that they want to be interested in. But that's a failing premise. I can tell you from experience. If you have a resident who doesn't want to do research, you can't make them do research. If you have one who loves it, then just try to support them. So I think I'm much more supportive in my mentorship than I used to be.
And Ellen?
Yeah, thank you. Interesting, as I was listening to Mal, it's incredible how similar our responses will be. As I was thinking about your question, I was thinking, in my younger years, I used to think that I needed to have all the answers, right? And now I know I don't need to have the answers, but I need to, for my students, my trainees, I try to get them to, do the case the way they want to do it, to let them make mistakes, for them to answer their own questions, for them to introspectively look and provide their own answers. That when I was younger, I thought I had to tell them everything. And really that's not the way that today's trainees want to be mentored, or probably the way that we wanted to be mentored, as Mal said, right? He wanted to be mentored in a different way. That's how it changed his style.
So how did either of you find that what you took from the way you were mentored, and it's been a little while, I think we've been in practice 15 or more years, right? What did you take from your mentors that you still use, and what things did you decide you were definitely not going to do? Now?
Yeah, I mean, Palma, you remember what it was like when we were residents. I'm not sure if we had mentors. We had
So true.
we had people who demanded that we work. And so that whole system was kind of built around, we wanted to be them, right? So if we worked very hard and somehow got these people's approval some way, that we would become them. And that was really the goal. It wasn't them telling us, well, this is how you do this and you'll become, that's where we wanted to be, and we would do anything to kind of get there. But the next generation, that's not the case. They expect things to be completely different. I think that, there's a fulcrum between the baby boomers and us, Gen X, and the millennials, and it's just a change. They have more kind of a sense of justice, a sense of right and wrong, whereas it never occurred to us, that 150 hours was too many hours to work. It never occurred to me that there was anything called a duty hour log or anything like that, even though I guess it was the law in New York City for probably 10 years before they actually did anything about it. But these things never occurred to us, and they do occur to the younger generation, which I think is a good thing. So we have to kind of try to find a balance between, the way we did things and then the way they're going to do it.
Ellen, you're a mother of 2 children, and you balance a clinical practice as well as an educational practice. How do you adopt and bring forth what you valued from your mentors and help your trainees or your medical students find their way to find what they're looking for?
Yeah, good question. As I was listening to Mel talk, I agree. I had very few mentors. And I think that the first mentor that I actually had was when I was a fellow. And that was Felix Station. God bless him. He passed away several years ago. But I think that what he did for me, and what I valued the most, was that it was a partnership. He saw in me what was, what he could encourage me to do. He saw my good he saw the qualities that I had and pushed me to do, to be my best. And it's interesting. Throughout my residency, I agree. There are all these people around us, and they're all working a million hours, and we just wanted to be like them, right? We just wanted to succeed like they did, so we just did what they did. And so how do I incorporate some of those things that I learned from Dr. Station is really to emulate what he did. I think that you had asked in the beginning, like, what were some of the negative aspects that I saw, and negative aspects of, or not positive areas of mentorship that I saw, or how I was mentored. And probably the most impactful to me was when I saw myself and others not receiving credit when credit was due, not receiving credit for their work, and that has really impacted me, in that I go out of my way to make sure that people are given due credit for what they do. So
I would say that I'm contemporary with Mal and Ellen, and and I think that I agree. I had very few mentors. There was the one woman that I identified with who was a plastic surgeon. There was no way you were sure you're even going to finish the program. It was very malignant, very pyramidal. You just survived the day and worked as hard as you could, and there was no direction, no guidance, nobody picking you up when you fell down. You just got back up and kept working. So I think that I'm a program director as well for vascular fellows. And I think that I really am trying to be a little more nurturing and help guide them so that they can be happy. And I think that that's what all of our goals are. So, Linda, do you want to?
Yeah, so I think as the years, as we look at all these generations and the changes, mentorship and training has gone from, okay, I'm going to train you, you're going to learn out of fear and out of me being condescending, to now there's other constructive ways to train somebody. And so how, as we look back, how did you evolve? How did you, because sometimes mentoring is not just second nature. I mean, I think it can be difficult. And I feel like there's a lack of, training and being a mentor. And so how do you see that as a problem we can fix in the future, or how did you evolve so that you're more nurturing and more respectful, unlike your previous, when y'all trained?
Yeah, I mean, part of the issue, I think, when Palma and I were training was that, surgeons made a lot of money. They made a ton of money, and they had a lot of status. I remember the CT surgeons had the corner suite, and what they said went, and, they all drove nice cars, and then all of a sudden, that's not necessarily the case anymore. It's still kind of the case, but not like it was in the 90s and 80s. And so we can't just expect people to be running over themselves to be a surgeon. There's a different calling now, hopefully a better one than wealth and power to be a doctor. So I think that comes into play when you're talking about mentoring these people. They have a different sense of what they want to be and where they want to end up. I think as a mentor, it's hard. I see people who just can never be good mentors. They just don't have it in their time. They don't have the patience. They don't have the flexibility, I think is the key part. But also you have to be a good mentee, right? I think that's critical. There are students who just have no idea how to get advice or what to ask for, or how to kind of work with a busy surgeon. I had a student 15 minutes ago who, I caught me coming out of a femoral pseudoaneurysm. We have a thoracic duct injury that I just got my wife somehow to cover. I got to be on with the Sisterhood here. And he's coming up to me and starts chit chatting. And I'm like, you know what? I'm super busy, but tomorrow we're going to sit down. We're going to talk about all your problems, and it's going to happen. But I think, that kind of sense of how busy surgeons are is very important for students and residents to understand. And the good ones, the ones who are going to get good instruction, kind of take that into consideration, figure out a good way to communicate with someone you want to be a mentor, and kind of work out that time, because time is the thing that none of us have. And if you can find that key to getting good mentorship, it's just figure out that time, figure out when that person can come, and don't come up to somebody and say, I want to do research, right? I hear that, that statement 1,000 times a day. I want to do research. Well, great. What do you want to do research? So, spend a little time, figure out what they do in your hospital, do a little lit search, come to somebody prepared, and that you're going to get much better mentorship if you do that than just kind of these open-ended things, in my opinion.
Ellen, do you agree that a good mentee that takes a proactive stance can get better mentorship than one who might just, like Mal said, oh, I want to do research, but doesn't have anything specific in mind?
100%. Remember what I said in the very beginning was the one positive mentor that I had. The first thing that I said, that it was a partnership, right? Yeah. And so it's a two-way street. It doesn't just come from the mentor, and I agree with Mal that a student or a trainee coming with a plan in mind, and not it doesn't even have to be well thought out. They're just some ideas of what she or he wants to do, and have that conversation, I think, is very, very important, because it shows the investment of the mentee or the trainee, and how their investment in themselves, which I think it also excites and motivates the mentor also. I agree that I don't think there's a lot of good training out there for mentors, right? And that's part of it too. Perhaps that's something that can come out of this, right?
Sometimes, like Ellen was saying, that they have to come up with the plan, or should come up. Sometimes even a terrible plan, like an absolutely atrocious plan, is better than no plan, because a terrible plan will catch my attention and be like, oh no, do not do that. Like that's a terrible idea. That'll catch my attention more than somebody who just has no idea and is just walking around the hall. So yeah, just come up with something.
Palma, what are your thoughts?
Yeah, I do appreciate when there's a more focused approach and someone comes to me with a general idea. I think that Mal and Ellen brought up excellent points about, it's really time management. And I did talk to a couple of my medical students and residents before in preparation for this. And, one of their comments are that, the medical students and some of the residents are a little bit intimidated to approach one of us to ask questions or have you be their mentor. Obviously, we're always super busy. But the reality is that we're not really given time in our lives to actually be a mentor. We try to fit that into everything else. So I think that is one of the challenges, that we want to be a good mentor. It is hard for us to find time, just like it's hard for these trainees and the medical students to juggle classwork, schoolwork, and their lives and their partner in life, and maybe they have children and they're trying to juggle all these things. And I think that some of the millennials don't think that we appreciate that they're trying to juggle having a little bit of a life, having a good family relationship, and all these factors, many of which, and I want Mal and Ellen to comment, is we've made many sacrifices in our personal lives to be successful at what we're doing. So I thought that it'd be great if Mal and Ellen each are married to physicians. It's been a while. You've been married, probably 20 years, and nobody was there to help mentor you in making that marriage work and having the children, and whether one partner cut back on some hours or not, or how you did it. What were I think the trainees would love to hear how you figured that out, honestly.
I'm hoping Ellen figured it out so I can take some from her.
I was really hoping Mal was going to take that one. Accurate.
I guess you're in theory. I don't know. I'm not going to be fact checked on this, right? My wife is not on this. All right. So
she's doing that pseudoaneurysm.
There are different actual theories about this, right? And so one is the four burners theory, where basically no one can do everything. You just cannot. So give that up right away. The people who I have were friends in college know that they may not hear from me for a year. But when they do, I'm going to act like nothing happened. Like, yeah, what do you mean I missed your calls? And so those are the people who have stuck with me, because, I have 3 kids and they cannot be neglected. Like, under no circumstance can I let that happen. So when I'm home, I try to make it all about them. And so I will, on weekends, like this past weekend, Saturday was just, we went to the World War II Museum, spent the whole day there. Sunday, I came and did letters of recommendation for 30 medical students. So I was in the office all day. But, it's just kind of, I think if you try to do everything at once, you're going to fail. So carve out that time. Like, my wife wants to do, I don't know, something ridiculous this Saturday. So I say, sure, that sounds awesome. So I'm going to do that. And that's carved out time. And you just have to kind of take these chunks of time and make it happen. But if you try to do multiple things at once, you're doomed to failure. It just cannot work.
Yeah. It's a lot. It's all about the quality of the time, right, Mal? Not really the quantity. Everybody's heard that before. It's quality, not quantity. But it really, hits home for surgeons, who are busy, when we're at the hospital and we're taking care of patients, we're engaged there. But when we're home, we've got to be engaged at home. And we have to make that time. Can't just work 24/7, like some of our predecessors did, right?
And you have to figure out when that quality time is, right? So in the beginning, my wife and I, we have to go into work early. The kids are going to school. The middle one doesn't have his homework. The younger one is naked, and it's just a giant mess. And I'm like, this is not quality time. So we have the nanny come early, and the nanny will deal with that nonsense, because nobody's, loving each other at first thing in the morning when we're all going to school. So we don't take that as quality time. But in the afternoon, when I get home and we're doing our homework, that's when I want to help them and spend more time. So it's just kind of figuring out, this period of time, a nanny can do that, or it doesn't have to be me. It's going to be a terrible experience regardless of who's in charge. So let's give up on that one. And then after school, when there's homework to be done, I can try to teach them that's when I'm going to try to take over.
And I think the child care that you're able to obtain, whether you get a reliable nanny or you have a family member, like my mother helps me now, but before I had a whole family basically were my caretakers in Boston when I was there, and I'm a single mother with 2 children. So basically I just juggled for me and the children and coordinated in a large way my entire life, and along with the call schedule and the residents and everything we had to do. So my children, I think they had to understand that, you know, if it's just me, well, I can't tolerate the room being messy. You're just going to have to clean it up. So I think that I feel like I had to be stricter with my kids. I just couldn't tolerate, like, you know, those toys when they're growing up, they're like lots of small parts and pieces that got all over the place and things like that. We had none of that. I was not cleaning up those toys, you know. So I think we have to adapt to our environment to be successful in juggling all of these things.
So a question came in on
new mom. You can comment about juggling being a new mom and the kids. And
well, being a new mom is great. It's super fun, and yeah, I mean, definitely when I'm at work, but when I'm at home, I'm just with her. And right now she's going through like some sleep regression, so she wakes up every 2 hours like screaming. So that's been fun, but you know, you manage. You find ways to take naps somewhere. But we did get a question in about this topic, and the question is, how do you find a reliable nanny?
Word of mouth.
That is a hard one.
Mao, you and I are so on the same page.
We should have our own show, Ellen. We don't need these people.
That's right. No, word of mouth is absolutely true. You know, we should all talk about our nanny stories, right? How did we find our nannies?
Yeah, well, so some resources would be care.com. I know a couple of my friends have used that, but yeah, word of mouth. Some kids get older, they don't need a nanny, so that's when you go in and you snatch that person's nanny before anybody can you know, take that nanny away. I know at my institution there's a separate child care facility that's only for Houston Methodist employees, that's open early and opens up early and then doesn't close until I think 7 p.m., which is pretty late for some most childcare facilities. So, and you get a sort of discount. So that's nice. I don't know about the other programs or any other advice you can give on that.
Yeah. I agree. Some institutions do have facilities, you know, at the hospital or the office, you know, environment for trainees, for residents, for attendings, probably through, if we're talking about medical students, really through student affairs. But when we jokingly said word of mouth, what I meant by that was really networking, right? And speaking to folks who, if you have those resources, speaking to others who have children, older children, they may have a nanny that is looking for something new, or their nannies may have friends. And that actually is how I found my nanny of, let's see, going on 17 years. She met my daughter when my daughter was 2 months old. She came to my apartment and she held my daughter like this, and I said, I fell in love with her, and she's still with us. So, but like reliable, trusted sources are really, really the best. But if you don't have that, then yes, places at the hospital, most places have those resources for you.
Any other comments on the nanny finding?
I've actually advised some of my residents to consider the females, actually, if they were going to start a family, if they're going to select a training program and their family, for example, lives in San Francisco, I'd consider San Francisco, because if you can have some family nearby, not that they would provide full-time care, clearly, but it gets really expensive. A lot of surgeons end up needing the equivalent of 2 nannies or 2 au pairs, and it gets to be very expensive. So if you have I know, Mal, you use your dad quite a lot. Every time you guys come up to New York, Dad's on call. So if you can rope a little bit of the family in to provide some support, it's much cheaper, and who better to watch your kids than your mom or your dad or your sisters. So I've used my family whenever I possibly can. So that may guide where you choose to do your training.
Agree. So speaking of mentees, so one of the questions was, when you have a mentee and they some mentees just don't get it, or are struggling with burnout or struggling with their training, or have expressed to you that they're just struggling in general, whether it be in their personal life, their work life, how do you mentor that mentee, and how do you turn that around?
Well, it depends on what exactly is going on. Burnout is a real, like, it's a clinical syndrome. So it's not something that I can coach somebody out of or talk somebody out of it. It's more preventative, I think, from our end. The depersonalization, the kind of downward spiral. Once somebody's burned out, that's a clinical scenario, and they need to be treated by a professional, because the suicidal ideation triples, quadruples in that thing. So that's, I think, an important thing for a mentor to realize, is you cannot mentor someone out of that. You have to know your limits. So I think as a mentor, when you see young people, you try to teach them balance early on, and how to kind of put things in perspective. And that's where I think, people like us have our role. It's not, not when someone burned out, not when they've reached that kind of end point.
Yeah, I would tend to agree. I just want to give my 2 cents here, because I think that this is very serious. So when not just somebody comes to me, but if I've identified, or I think that someone is in trouble, I go to them, right? And if you have that relationship, mentor-mentee, then hopefully that your mentee is going to be speaking to you about whatever it is. And I agree with Mal. We can't coach someone, or we can't mentor someone out of depression or burnout. We can only try to prevent those things, and that's the other thing I agree with. But I'm very proactive in getting the student or the trainee help through either student affairs or GME, because it's very serious. We as our generation didn't really talk about suicide, but it's a problem amongst physicians, and also notably amongst women physicians, and we need to be able to talk about it, make those appropriate referrals to help people. But I think prevention is the key, and it starts early on, right? In giving our students the tools in order to cope and to deal with unexpected findings or unexpected events, like what's going to happen the first time that somebody, sees a patient die. It's, we sitting on this panel, we've seen it. Other people haven't. And it's about preparing people, and that can really impact a student, having that experience for the first time. So I think we need to be very proactive, but we also need to be preventative.
If people who are burned out, actually clinically burned out, don't walk around saying, I'm burned out, right? That's not how it works. They just kind of become more and more distant, more and more depersonalized. They actually will stop saying much of anything. There's just a tremendous disconnect. And that's where the risk for substance abuse and suicidal ideation comes in. So like Ellen said, it's a preventative thing. When it reaches a burnout point, that's a clinical issue that needs to be taken much more seriously.
I think it's really good that we're talking about this, but the funny thing is that, in fact, one of the medical students had commented to me that, they note that we don't really always get valued. And like Ellen had said earlier, you don't get credit for what you do, but reality is that we have a really hard job and we work really hard and we're not always valued. Sometimes the patients don't value us. Sometimes our boss doesn't value us, and you don't feel like, as hard as you're working in the midst of the pandemic and everything that you're doing, you're not really doing anything particularly special because nobody really thanks you for any of that. And it happens too often. And I think that that contributes to burnout because you're tired, you're exhausted, your outcome isn't always exactly what you want. That vein you just harvested was a B vein, not an A vein. I mean, it wasn't quite that perfect greater staffins that the ultrasonographer insinuated it was going to be. And you just went through the whole stress of dealing with all that. And you come out and it's just like nothing ever happened. So I think that that is summative. And I think that as attendings, we carry that burden. And I think that the trainees see us in that position and they think, well, why would I want to do this? It's hard. And then there's a lot of discussion. Our dean is very into, burnout and, avoid burnout. And they're all talking about this, but the OR scheduling still gets messed up. The transporter forgets to go get your patient. Your case starts an hour and a half late for no good reason. And then you miss your kid's soccer game because somebody decided to go to lunch and you're the one, it's all of these things. So I think it's important that we talk about it, but I don't think it's something that's going to be fixed quickly. I think it's a systems issue in the hospitals and our training programs and in our lives. And I think it's good that we're starting, but I don't think we're even halfway there at this point.
No, and
Right.
That's what, is important about that. We talk about mentoring these millennials. I mean, in fact, I think and maybe I'm a millennial, I don't even know, but that they're teaching us, because before you would just be, all right, well, I guess I'm just going to miss my kid's soccer game. Okay, well, I guess, but it's not okay. We're people too, and we're not getting paid as much as we used to. We're no longer like, that's like back in the day, the cardiac surgeon who, gets the free meals out when he goes out, the free vacations, all those things. Now we're getting reimbursed less. There's more paperwork, and so I think the millennials are seeing this and they're saying, well, I want to be a physician for the right reasons, but I don't want to give up. I'm working to live, not living to work. And so that's something I've learned. I always tell my residents all the time, don't ever work for free, because in the corporate world nobody works for free. So why should we? So that's my big thing. But another question came in. Do you ever dissuade someone from being a surgeon if you perceive a bad fit?
Oh, yeah. Yes, absolutely. It happens a lot. But the old adage is, right, you become a surgeon if you don't want to do anything else, right? If you become a surgeon because you have to be a surgeon, right? Because it's kind of an insane thing to be. But I think that the people who are happy being surgeons would not be happy doing anything else, right? So, I think I'm very happy. My wife is very happy, and I don't see another career where I would have been happy. I think in the end, it'd be nice to be rich and famous and a movie star or whatever. But in the end, I don't think I would feel fulfilled by that. So that's the thing I look for is you want to be careful that you don't over mentor people. And by that, I mean, I think I have a good group of surgeons. We have fun, we work hard, but to the students, it seems like, wow, this seems like a cool thing to be. They're all like enjoying it. I'm like, we're enjoying it because we're us. If you want to do it because you think that you fit in personality-wise, it's not a good reason. You don't want to just be here to be us when we're all together. You want to be that person who's alone at 2 a.m. doing the trauma that the students don't always see. If you can be happy doing that, be a surgeon. But if you just want to hang out with cool people, there's a lot of other careers to have. So you really have to make sure you're not kind of overselling your specialty to people, because that's something we've got caught up in the past, I think.
And Ellen, another question. What are some of the simple things I can do if I recognize a burnout occurring, says one viewer.
So can I just ask for clarification? Is this if I see burnout occurring or symptoms of burnout in another person or in myself?
I think the question is asking if, number two, if if you saw yourself showing signs of burnout, what can you do for yourself to help that?
Yeah. Well, I think the first thing is to, take some time and to be introspective, right? What's happening in my life, what's going on, and then it's all about finding help. I'm a big proponent, like I said before, of being very proactive with, if someone is feeling stressed and overwhelmed, reaching out for help to, if this is a student, to any of the faculty, to any of the deans, to your course or clerkship directors, to the residents. It's anyone in the GME office. It's even fellow residents might be able to help, but it's reaching out and asking for help. I have this little thing here. It's actually a drawing from Christopher Robin, and it's Pooh Bear talking to Piglet. And Piglet says, "Pooh, what's the bravest thing you've ever asked?" asked Piglet. And Pooh said, "Help."
That's very true.
Ask for help.
Yeah.
Ask for help.
It's not a sign of weakness to ask for help. In fact, it's a sign of strength that you are in tune with yourself, and that you're self-aware, which is one of the most important factors in leadership skills. Actually, is that you're self-aware. But there's a lot of questions coming in. So let's see. Palma, maybe you can answer this one. I have felt really supported with some very incredible surgeon mentors. I was hoping the panel could talk about the balance of working with mentors in a professional manner, letters of recommendation, research, education, versus in an emotional support manner, burnout, life, work matters.
So I think that, at least with respect to me finding mentors, I found that I love being on committees. I'm on so many committees and running committees and things like that. And I would never have known that I like doing that stuff, but I love it. And I found that I connect with a lot of people across the country that way, and I feel very engaged. So if work isn't, I don't feel fulfilled in work, at least the people in the committee are appreciative of the stuff that I'm doing. So I think that, now trainees and the residents can actually become ad hoc members of different committees and different societies. I think that's really important, especially I think it will help with burnout, because you find like-minded people. Maybe you and that other person, you're the vascular surgery interest group, you're all interested in vascular surgery, or just finding some other people that you don't feel alone. And with respect to, burnout, I'm pretty much a workaholic, and it's a sickness, but, if I'm not working hard, then I think there's something wrong. So maybe that's why it's good that I'm a surgeon. But it is important to spend time. I like to exercise or work out. I think you have to find that thing that takes your mind off of work. So if you do like a really hard workout or go for a really strenuous run, or you do something or very engaging that takes your mind off of all that stuff that's stressing you out, is very refreshing. I think that's all part of keeping yourself positive and keeping things going.
Mal, Ellen, any comments?
Yeah, peer support is the big thing, right? So you said a mentor for burnout. It's not the most effective relationship when you're dealing with burnout or preventing it. It's peers. The people who are going through exactly what you're going through at the same time are the best resources for preventing burnout. So I remember when COVID was peaking everywhere, and Max Swoller, who we all know, vascular surgeon in Denver, started these Zoom social hours, and people would just log into that. And it was just a kind of a natural way for peers to find each other during this time where nobody knows what's going on. All our cases are getting canceled. Who's sick, who's healthy, what's going on around you. And just those kind of organic peer support groups seem to be very, very effective ways of staving off burnout.
Any last minute questions, Palma? We have a few minutes left.
That went fast.
Any last minute comments? Oh, another question actually. Are there lots of questions? That's great. Are there particular personality types more prone to burnout? I see a lot of folks who should be burned out but handle it. What's the difference?
Resilience,
Yeah.
right? Having those skills to be able to bounce back, right? Everyone is faced with tragedy, dilemma, etc. It's how you handle it. Okay? And that's really the definition of resilience.
I would agree with that. I think that is a very important quality to have, resilience. You know, you fall, everybody falls down. I mean, we all fail. I have failed so many times I cannot possibly count anymore. So, but when I fall down or fail or whatever happens, I say to myself, get up. Yeah. I mean, no matter how bad the day is going, I'm like, get up. Like, I just tell myself, get up and go. And that's it. And then it passes, it gets better. And I think Ellen's right. I agree with you. The fight to go forward.
Mal?
I just want to quickly say that resilience training is great for the individual, but for burnout, it's a systemic issue and it needs systemic change. So I see a lot of time the hospital CEO, they'll realize how much money they're losing to burnout, so they'll start all these wellness programs, which are really resilience programs, right? So they do the yoga and all this other stuff, which is great, but it just teaches people how to deal with a system that is broken. So while resilience training is great and everybody should seek it out and it's helpful to you, if you are in charge of a healthcare system, in no way should that be your priority. Your priority should be to fix what's giving people the burnout and not teaching them how to deal with it.
Well, that is a whole nother series of like 10 shows right there, actually
There you
talking
go.
about fixing burnout. I know personally, when things are rough, I try to find a little bit of humor in whatever's going on, because there's always a little bit of something. And, you know, in terms of mentorship, sort of thinking in my head, like, who are my mentors and how would they handle it? And just, you know, having someone to look up to and saying, you know, if they can do it, I can do it, you know. So that's how I handle dealing with troubled times. I think we need to wrap up. Thank you so much for all your advice and taking the time out to mentor the audience, and we learned a lot. We will have a part 2 of this topic next month, where we'll invite some millennials on the show and to give their perspective on what they look for in a mentor and how they perceive work-life balance.
Thanks, everybody.
Thank you for the opportunity.
Thank you so much.
It was great. Thank you.
Good to see you guys.
Bye.
Thank you.